we're going to be talking to Dr. Sean Rice. Now, you've heard of Botox, right? You've heard of things like that. Those are called, what are they? Neuron modulators? Which, like Botox is a toxin that you're injecting into your face. It sounds scary. But now there's something new on the horizon, and it's called Dysport. Apparently, Dr. Rice uses this quite a bit now instead of Botox. So we're going to find out what that is. How does it work? So I'm going to go talk to him now. Let's do that. Okay. Doctor, we're being very spontaneous today on the show.
Sounds good to me.
Yeah. Well, I wanted to really get the details on this Dysport because it sounds interesting. Botox, we know is botulism that you're injecting into our faces, but it seems to work and it seems to have no real side effects. But tell me about this Dysport.
So Dysport is sort of the competitor now for Botox. It's the same thing. It's a neuromodulator. It's been around in Europe for a long time and just sort of came to North America about a year ago now.
Okay. Does it give you that frozen face look that Botox tends to do if you use it too much?
Yeah, I mean, you can still create that frozen face look, and that's really where the art of injecting sort of comes into play. The interesting thing with Dysport or Dysport is that it tends to sort of kick in maybe a little bit quicker than Botox did. The efficacy is about the same, though.
Okay. How long does that last?
If it's the first time you're using it, maybe 3 months. Sometimes it'll go up to even long as 4 months, but really 4 months is about the maximum you're going to get out of it.
Okay. And you'd notice because your husband starts saying, "Why are you so angry at me?"
That's right. You start to notice the wrinkles.
Right.
Sometimes you get a bit of a headache because they are used to prevent migraines. So as the artery relaxes, you start to get a little bit of a tension headache, and that's a bit of an indication. You start to sweat, too. So you see women at the gym that aren't sweating while they're on their exercise bicycle. They start to sweat again. It's an indication that it's starting to wear off.
Time to make an appointment.
Right.
Okay. What else are we going to talk about today? I've had a consultation and they say, now you should know what could happen is you might, have a droopy eye and one eyebrow might go up like this.
Sure.
So why would that happen?
Well, when you inject a neuromodulator, what it does is the nerve has a little signal comes down, and then there's a chemical that comes across from the nerve to the muscle. And what you're doing with the neuromodulator is you're blocking that chemical. The neuromodulator has about a 1 centimeter diffusion gradient to it. So let's say you inject into the forehead. If you were to go to the gym or you start rubbing your forehead or you went to sleep, then you could expand that diffusion gradient. Now it may hit a different muscle that you didn't intend to, and you can get a bit of a droopy eye.
Okay. Temporary.
Temporary, for sure.
But you've got to wait for the whole thing to wear off.
Right, and sometimes you can come back to the office, we can sort of tweak, block a different muscle to help the other one pull up. So there are kind of things we can do.
Okay. But now you've got this terrific vein viewer that'll help you avoid causing a lot of that problem.
Yeah, so one of the problems when you inject toxins into somebody is that, or any sort of a fillers, you can get a bit of a bruise, right? And that's normal from any needle. So one of the things we have now is the vein viewer is a fantastic tool to sort of help us find those little veins.
Because nobody wants to go back to work the next day with a big fat bruise that says, "I just had my Botox or Dysport injection."
So this is a great tool. It was originally designed to find the veins in children in the neonatal units. So what we do is we use it now kind of to sort of not to inject into the vein, but to kind of let us know where the vein is so we can inject around it. Kind of the reverse is what it was intended for. So it's a near-infrared light, and if you can see, I'll shine it on your hand. So what happens is the near-infrared light picks up the hemoglobin in your blood vessel.
That's so cool. Those are my veins.
Yeah, so there's your veins there. So if I take your vein and I block it off, I let it go, you can see the blood flow come back again. So if I block that down, you can see it come back. So what we do is we inject into, let's say you're injecting a neuromodulator, Dysport, or Botox around your eye. I can now turn that around the corner of my eye. I can see where all the vessels are. And now I can bypass those vessels and go around it. Hopefully you won't get a bruise from it.
That's amazing.
That's a fantastic tool.
So it just sees right through your skin.
Right, so it's bouncing off the hemoglobin. When you go you're having an operation, they put the little oxygen oximeter on. It's the same technology. They just turned it into a fancy machine now.
Wow. Now, the people at the blood clinic told me my hemoglobin was low, but that didn't seem to have any problem reading.
No, it won't have any effect on that.
As long as you've got some.
You have some, and it's flowing.
What sort of anesthetic do you use for a treatment like that, a procedure?
You know, some of the new fillers now have some lidocaine or some local anesthetic built into it, so we don't usually use a lot of topical for it. If you're getting some more injections done, and let's say you're a little bit queasy or a little bit apprehensive, we've got a fantastic tool now called the Pronex. Pronex is sort of a combination of oxygen and nitrous oxide, kind of the laughing gas from the dentist. You put that on, you take a little whiffs of it, sort of puts you off in the la-la land, and it works great to take the edge off.
Did you bring any of that?
No, the staff has it back in the office.
We'll be right back. We'll talk some more about the latest trends in plastic surgery and all the other cool things you can get done at the Rice Cosmetic Surgery Clinic. All right, plastic, cosmetic, reconstructive surgeon at Rice Cosmetic Surgery, Dr. Sean Rice, is here today. We're talking plastic surgery trends. So Botox is it on its way out, would you say?
No, you know, if you look at statistics, it's actually on its way up. The numbers are keep increasing. It's just that now the competitors, Dysport and Xeomin's, the other one, are now available in North America.
The root of them is still the same? Still
the same root, that neurotoxin, and the efficacy and how they work are the same.
Just a different
product.
Vying for your dollar.
Yeah,
right?
Exactly.
Okay, and what are some of the other trends that are happening with the surgery and the fillers? What can we be making appointments for?
Well, you know, certainly the non-invasive, the fillers are having a big sort of boom as people are trying to put off having a facelift and more sort of the invasive surgery. So that's a big trend that we're seeing these days. And there's lots of new sort of fillers on the market now. And the fillers can either come in two ways. They can come in what you typically know as the hyaluronic acid fillers. So that's the Juvederm, the Restylane, the Perlane. You get that injected, you see what you look like right away. And then they come in the stimulants. So stimulants are for people that don't want to have a result immediately. So particularly men. So if you want to have something injected, you don't want to walk out of here in 30 minutes and have somebody go, you know, what'd you do to your face? If you wanted to see that result, the same result, but you wanted to see it 6 months down the road, then the stimulants work great.
Why? I don't understand why you would want a result 6 months from now.
Well, sometimes you don't want people to know right away that you've had it done, right? Particularly, you know, guys don't want to walk out, have big cheeks, but they still want some fullness to their face, so they want to have it done very gradually over time. So the guys are, you know, harassing them at the gym and things like that.
So that just eventually somebody goes, oh, hey, Bob, you're looking better these days.
Yeah, you go on a holiday, something like that.
Yeah. What is this, Volbella?
So Volbella is the latest hyaluronic acid filler. It's made by Allergan, part of the Juvederm family. It's a fantastic filler specifically designed for lips.
Okay. Well, we've seen the people who've gone overboard with the pouty lips.
Right. And one of the problems of going overboard with the pouty lips, there's a couple secrets to the lips. You always want your lower lip to look bigger than the upper lip. And the problem with some of the previous fillers is they were quite sort of thick and viscous. This is a really thin filler, so we can really mold it nicely. So this is one of my staff in the office. So what we did was, this is one syringe of Volbella, and you can see you get a very nice and a natural look to the lip. It's not really overdone. And again, the lower lip a little bit bigger than the upper lip, so you don't kind of get that ducky look.
Oh, I know. I don't know why people don't. Do they not see what they're doing to their face? Do they not notice it?
You know, I think you hit a thing that looks good, and then sometimes you want to go bigger, and it's sort of our job as your surgeon to sort of say, time to tone back and not go so big so you don't look that kind of strained.
How long will that last?
You know, the lip, it generally lasts you somewhere in the range of about 9 months. The lip is quite vascular, so it doesn't last as long as you did it on the cheek, but you're looking at about 9 months.
And the cheek, you can use that same product in the cheek?
You can use, when you start going to the cheek, now we're looking for a more viscous product, something that's really sort of thicker, that's going to really lift things up. That's when we're starting to look at things like the Perlane or the Restylane.
Aha, that would be these products here. Okay.
So Perlane is the same. It's a hyaluronic acid, but it has what's called a G prime. It's sort of a stronger product to really hold up the lip, or sorry, hold up your cheek.
Right, to fill in the volume that you've lost. Right. Where has that volume gone? Is that fat that we've lost or muscle tone?
You know, as you age, you lose it everywhere. So if you want to look great, you have to address the bony component, you have to address the soft tissue, the muscle, and the fatty component, and then you got to look at your skin, right? So if you want to look great, you got to address all three of those. So something like the hyaluronic acids are great for the soft tissue. Something like Sculptor is really good to sort of re-give you that bony sort of structure to your face.
Cool. Well, real quick, show me this vein viewer and how you are able to now, in the office, give us, whether we're getting Botox or an injectable, give us those needles without creating a bruise in the process.
Right. So, anytime you inject something, there's a potential of getting a bruise from it. So anytime you put a needle anywhere. So what we're doing with the vein viewer is we're able to track where your veins are. So I'll show you as an example. So if what happens is this is a near infrared light, and it's attracting to the hemoglobin inside your blood vessel. So we can track where those blood vessels are. So now if I need to inject something, I can inject around the side of it.
So wild. Look at that. And you can feel absolutely confident that where you're sticking the needle is the safest place or the best place to do it.
Right, exactly.
That is awesome. And so show us on your face.
Right, so the typical spot we would use it for, say, like Dysport or a neuromodulator. So if I'm injecting, there's little blood vessels that come around the corner of my eye, and sometimes that's where you get that bruise from. So what I'm going to do is I'm going to find those blood vessels, and I'm going to kind of inject around it. So it's a fantastic tool so you don't get that bruise.
That's wild. What are some of the other products you brought with you today?
So some of the other ones we have are kind of the stimulants and then the sort of fillers. So some of the stimulants that we use are products like Sulfo, which is PRP, or platelet-rich protein, kind of what they sort of call the vampire lift that people sort of know of. So the vampire lift is really a combination of the Sulfo and something like the Restylane or Perlane.
What is the vampire lift?
So what we're doing with PRP is we're taking some blood out of your arm. We take the growth factors out of that blood, and we put it through a centrifuge. We stimulate it down, and you get sort of a clear yellow serum, and we inject that back into areas. I've had it injected into my eyes. Works fantastic for areas, crow's feet, sort of little wrinkles. And the sort of coolest thing about it is you're using your body's own natural defense mechanism to sort of stimulate itself. So you're kind of tricking the body into thinking you've had a cut or an injury, and it's sort of creating new collagen in that area, and we use it sort of as an aesthetic advantage.
That's wild. What's the best age to start these procedures? Like, you see the girls in Hollywood as young as 20 doing this stuff. Is that necessary?
Well, there's sort of a trend now to kind of use things as a preventative mechanism as opposed to sort of catching up. So things like the neuromodulators, the Dysport, the Botox, people are starting to use at a sort of a younger age now to really kind of prevent you from getting those wrinkles down the road. So that we do see people in their early 20s, 30s. Fillers, particularly lips, people are coming in their 20s, 30s. And then sort of the sculpture of things like that, we see sort of men in their 40s to 50s really coming in for that.
Very interesting. There's so much now, and there's lots of choice, and so you want to make sure you get a good doctor. We got a good one right here.
Sure, come by anytime.
Doctor, and the full word doctor, right? DrSeanRice.com for all the details. Thank you so much.